Hello student, now we are going to discuss another important topic in respiratory physiology, that is compliance of the lung, right? So in this session what we are going to discuss, first we are going to discuss the concept of compliance, then we are going to discuss how the compliance is measured, and then compliance and elasticity, what is the relationship between these two terms, and then the surfactant and compliance, what is the relationship. At the last we are going to discuss compliance curve and the different types of compliance, that is the static and dynamic compliance, and obviously at the end of the session we are going to discuss few MCQs. So this is our plan. Now let's start with the first one, that is the concept of compliance. So whenever I say what do you mean by compliance, what you are thinking? So compliance means it is the expansibility of the structure, or we can say stretchability of the structure, or you can say it is the distensibility of the structure or distensibility of the tissue. So if the structure is easily stretchable, if the structure is loose, then that is a high compliant structure. And if the structure is not easily stretchable, if it is hard, if it is rigid, if it is a stiff structure, then the compliance of that structure or the tissue is low compliance. So compliance is equal to stretchability or expansibility of the structure, right? But mathematical terms, when we use the term compliance with mathematics, then we use this formula, compliance C is equal to delta V upon your delta P. So whenever we say delta V, it is a change of volume upon your change of pressure. So per unit change of pressure, how much volume change is happening in a structure? If you calculate that, then that is a measure of the compliance of that structure. So whenever we say delta V, it is the volume change. So volume change of what? It is the lung volume change, okay? Lungs volume change. So with the volume change of lung upon your change of pressure, okay? Pressure change. So what pressure change you are thinking of? So whenever you are expanding the lung, either you have to change the intrapleural pressure or you have to change the transmural pressure. So we have discussed the different types of transmural pressure. So either intrapleural pressure will be there in the denominator, or maybe different types of transmural pressure will be in the denominator. So whenever we say compliance, we use this mathematical formula that compliance is equal to delta V upon delta P, volume change of the lung or volume change of the respiratory system upon your intrapleural pressure or the transmural pressure. So if I give an example, okay, then you will understand this mathematics in a beautiful way, right? So look at this question. A person inhale a tidal volume of 600 ml. So the tidal volume of the person is given. During inspiration, intrapleural pressure changes from -4 centimeter to -8 centimeter. So the person is taking inspiration, and we know that during inspiration, intrapleural pressure become more negative. So from in this question, the intrapleural pressure is changing from -4 to -8 centimeter of water. And because of this change in intrapleural pressure, the lung is expanding, and because of the expansion of the lung lung is sucking some air from the atmosphere, and that is nothing but your tidal volume. So in these cases, whatever expansion is happening inside the lung, that much amount of air lung is taking from the atmosphere. That means this tidal volume, the volume which the person is taking inside his lungs, this is due to the expansion of the lung only. So this tidal volume is nothing but the volume change of the lung, and how much that is? That is 600 ml. Now this volume change or the tidal volume the person is taking because of the change in pressure inside the intrapleural region. So how much intrapleural pressure is changing? So intrapleural pressure change, okay, this is nothing but your delta V, and delta P here is from -4 to -8. So both are in negative. So 4 centimeter of water is the change of pressure in these cases. So now I can understand from this given question that the delta V for this person is 600 ml, and that delta V is due to change in pressure in the intrapleural pressure. And how much that is? That is 4 centimeter of water. So obviously if I want to calculate the compliance of this person, it will be equal to delta V upon delta P. So delta V is equal to 600 ml upon your 4 centimeter of water. So if you divide this, so this is nothing but 150 ml per centimeter of water. So look at this unit. So compliance is equal to 150 ml per centimeter of water. That means if you change only 1 centimeter of water pressure, for that 1 centimeter of water pressure change, how much volume change is happening inside the lung? 150 ml volume change is happening inside the lung. That is the meaning of compliance, that if you change 1 unit of pressure For that 1 unit change of pressure, how much volume change is happening? That is the compliance. Getting my point? So mathematically, compliance is volume change per unit change of pressure. If the volume change of a structure is more, then the compliance is more. If the volume change is less, so compliance is less. So basic thing is that compliance means it is the stretchability, it is the expansibility, it is the distensibility of the structure, how expansile the structure is. More expansile means more compliance. Okay, now we have to measure the compliance. How to measure the compliance of a person? Okay, so look at this diagram. So in this diagram, the compliance is being measured, but for the measurement of the compliance, you require at least the spirometer. So the spirometer is going to calculate the change of volume in your lung. So what you are going to do, you are going to measure the compliance. So what you require? Delta V, volume change. How you are going to measure the delta V? I require the help of spirometer, right? Spirometer. So in this diagram, the spirometer is connected at the mouth of this person, and what the spirometer is going to measure? The spirometer is going to measure the change of volume of the person. And then also you have to measure the delta P. So delta P measurement means you have to measure the change in pressure in the interpleural pressure. So interpleural pressure change you also have to measure. Now you know that the intrapleural pressure is also known as the intrathoracic pressure, that we have already discussed, and the interpleural space is a closed space, right? So the mid-thoracic part of the esophagus, which is present inside this thoracic cavity, that is a collapsible tube. Mid-thoracic esophagus is a collapsible tube because of the upper esophageal sphincter and lower esophageal sphincter, they normally remain closed. So in resting condition, the collapsible tube is there inside this intrathoracic region. So whatever pressure is there in the interpleural region, the same pressure will be there inside the esophagus. That's why the intrapleural pressure is measured with the help of intraesophageal pressure. Intraesophageal pressure, right? So the intraesophageal pressure is a surrogate of the interpleural pressure. You cannot measure the interpleural pressure directly, although nowadays it can be measured, but generally it is measured at the pressure at the level of mid-thoracic esophagus. So whatever is the pressure inside the thoracic esophagus, mid-thoracic esophagus, the same is the pressure in the intrathoracic cavity, same is the pressure in the interpleural space. So to measure this interpleural pressure, what we have done here, we have put one catheter, and tip of the catheter contain a pressure transducer. So here is your pressure transducer. So this pressure transducer is measuring the interpleural pressure change or intraesophageal pressure change. So this is the setup. Okay, so this is the setup. Pressure transducer is attached and it is measured the pleural pressure. Now what the instruction you have to give to the subject? First you instruct the subject take a deep inspiration as much as possible. That means the subject is inhaling in a maximum volume. So we are calculating this measurement with the help of this graphical representation. So this graphical representation, x-axis represent the volume and y-axis represent the pressure, right? So what we are going to do here, we are going to calculate the change in volume with change in pressure. So first of all, this mistake I am going to correct here. So in this axis we are going to plot the volume change, right? And in this axis we are going to plot the pressure change, right? We are going to plot this. So first of all, we ask the subject to take a deep inspiration as much as possible. As I told you that when the subject is taking a deep inspiration as much as possible, so he will reach up to a maximum volume inside the lung. So what is the maximum air that can be taken inside your lung? That is the total lung capacity. So suppose this is the total lung capacity. So after taking a deep inspiration, the subject has reached to a volume which is maximum, that is known as the total lung capacity. Now you are asking the subject to do a small expiration. Okay, do a small expiration, expire a little volume of air and then hold his breath. So now the person is doing a small expiration. So what will happen? The small expiration means the volume will decrease. Okay, and what will happen to the pressure? The pressure will decrease, means the graph will move in this direction. So now the person has reached in a position after expiring a small little volume, the person has reached in this position. So here is the position, new position. Okay, so now the person is holding his breath in this position after a little expiration. So whenever the person is holding his breath at this position, what you are going to do? You are going to measure that what is the volume at this condition, what is the lung volume at this condition with the help of spirometer, and you are also measuring what is the pressure, okay, interpleural pressure at this position. So you are measuring the P and you are measuring the V. Suppose this is V1 and this is P1. Got it? Then again you ask the subject to do another little amount of expiration. So now the subject is expiring a little amount of volume again. So again the curve is going down in this direction, and again you are asking that after a little volume expiration, hold your breath. Now whenever the person is holding his breath, again I am going to measure what is the volume in this condition. Suppose this is V2, and what is the pressure in this condition, and I am plotting on this curve. Suppose this is P2. So now in this way you ask the subject to expire the volume completely, so he will reach up to this zero volume curve. So this kind of curve is plotted. Now from this curve, if I measure the difference between V1 and V2, so this is nothing but the volume change, delta V, and if I measure the difference of pressure between P1 and P2, this is nothing but your delta P, and if you divide this delta V upon delta P, then you are going to get the compliance of this person. Getting my point? So this is very easy. So your basic target is you have to calculate the volume change and pressure change. You are asking the subject to do a little expiration and then hold your breath. Whenever he is holding, you look at what is the measurement, what is the reading at the level of your spirometer, and what is the reading at your esophageal pressure. Okay, and then again you are asking the subject to do a small little expiration. So he is doing a little expiration and then he is holding his breath. Again you look at your spirometer, what is the volume remaining and what is the pressure. So by this way, if you calculate the delta V, volume change and pressure change, then you are going to calculate the compliance of this person. So this way the compliance is measured. Very simple process. The compliance measurement is done. Okay. Now after understanding the measurement of the compliance, now we are going to understand what is the relationship between compliance and elasticity. Sometimes we use this term elasticity, but elasticity and compliance, the meaning is a little different. So look at how to understand the compliance and elasticity. So suppose I have given you two balloons, right? Okay. So this is one balloon. Okay. So not this much bigger balloon. So suppose I have given a balloon, this balloon, and I have given you another balloon. Initially, both of this balloon has same volume, right? So suppose initially both of these balloon has same volume, but the second balloon, this balloon, the wall of this balloon is little thicker. So this is a thicker balloon. So we all know that the balloon means it's a expansile structure. It's an stretchable structure and it contain rubber. Okay. So if the wall of this balloon is a little thicker, means the rubber is a little bit harder, and the other balloon it's a thinner. So initially both of this balloon has very little volume, little expanded, and the initial volume is same. Now I am injecting equal amount of pressure in both of this balloon. I am injecting pressure in both of this balloon, and how much pressure I am injecting? The equal amount of pressure I am injecting, means the volume pressure change in both of this balloon is same. Okay, whatever pressure you are changing, that is equal in both the cases. So delta P is same in both the condition. Okay. Now what do you think? If you inject equal amount of pressure in both of this balloon, which balloon is going to expand more? The loose balloon or the hard balloon? So the thicker wall means this balloon is a little harder. It is difficult to expand. So whenever we inject equal amount of pressure in both of this balloon, the first balloon is going to expand hugely because it's a loose balloon, right? But the second balloon, because it contains thick elastic band, it is going to expand a little bit, right? So less expansion in comparison to the first balloon. So in both the cases, we have injected equal amount of pressure, means the pressure change that I am causing in both of this balloon is same to same, delta P is equal. But for the same amount of delta P, the change of volume, the volume change of volume, that is a volume change, is that is delta V is more in the first balloon and delta V is less in the second balloon. Getting my point? So the delta V is more in the first balloon, delta V is less in the second balloon. So if I ask you that the compliance of which balloon is more, then you can easily answer that the compliance of the first balloon is very high and the compliance of the second balloon is low compliance. So if you compare this diagram, then you are going to understand the concept of compliance, that compliance is nothing but volume change whenever you change equal amount of pressure. Now, after expansion of both of this balloon, if you causes puncture of both the balloon, now you are doing a puncture with the help of a needle. So both the balloon has been expanded. Now you are making a puncture in both of this balloon. So whenever you make a puncture, what is going to happen with the help of a needle? If you do a puncture, then both of this balloon will collapse to the original position. It will collapse. Both of this balloon will collapse. Now this collapsing force is known as the elasticity of the balloon. So which balloon will collapse earlier, or which balloon will collapse with huge amount of force? The thick balloon, because this balloon is a thick rubber band, it will easily collapse to the original position. But the first balloon, it is easily expansile, but it will not be able to recoil back to the original position easily. So elasticity is nothing but it is the tendency to return to the original shape or original structure. So whenever the balloon was initial volume and then you are expanding and then you are puncturing, then both of this balloon will collapse. Both of this balloon will recoil back to the original position. Which balloon will recoil back to the original position with higher amount of force? The thicker balloon. And this returning to the original condition is known as the elasticity of the balloon. So if I ask you that elasticity of which balloon is more, then you can easily answer that elasticity of the second balloon is high in comparison to the elasticity of the first balloon. So what is the relationship between compliance and elasticity? From this understanding, you can easily understand that compliance is inverse of elasticity. If the structure is a rigid structure, then the compliance is more, but the elasticity of the structure is very high. If I give another example, you will understand a little better. So suppose you have two spring, okay, one of the spring is very hard spring and other spring, okay, so one of the spring is very hard, okay, like this, very hard spring, right, and another spring is very loose one. Now if you give equal amount of expansile force in both of the spring, you are trying to expand the spring, okay, with equal amount of force. So I can easily understand, because the first spring is a hard one, you are not going to expand much, but because the second spring is a loose one, so you are going to expand this second spring easily. So the compliance of this second spring is very high, because it will easily expansile. But after expansion, if you release both of this spring, which spring is bounced back to the original position with higher force? The first one. That's why the elasticity of this first spring is more than that of the second one. So you can easily understand from this example that elasticity and compliance, they are inverse of one another. Compliance is inverse of elasticity. Getting my point? So if the structure is a loose or easily expansile structure, then the elasticity of that structure is lesser, because elasticity is nothing but the recoiling tendency to the original position. Got it? Okay. Now after understanding this compliance and elasticity concept, we are going to move into the surface tension and compliance relationship. So first you try to understand what is surface tension. So basically we say surface tension is an force which is exerted at the air-water interface. Air-water interface. So to understand this concept, what I have done here, so this is a beaker or this is a container. Inside this container, certain amount of water has been kept. So on the surface of this water, air is there. Okay, so in a container you have kept some water. So whenever water is there and the air-water junction is there, we know that inside the water there will be water molecules. So suppose these are the water molecule, Gauss diagram. Okay, so suppose these are the water molecule present inside this water. So there will be multiple, okay, there will be multiple water molecule inside like this. Okay, now each of these water molecule, they try to attract with one another with the help of a force which is known as the cohesive interaction. So what I am saying, so these two water molecule, they will try to attract one another. Okay, they will try to attach with one another with the help of a force. This force is known as the cohesive interaction, cohesive force or cohesive interaction between two water molecule. So if you look at this water, so you will understand that the water molecule which are present at the deep of this water, the water molecule which are present at the deeper layer of this water, like for this water molecule, this water molecule, this water molecule, they are attracted by this cohesive force from all direction. Look at this. So the water molecule which I have highlighted with the yellow color, this water molecule is getting this cohesive interaction from all direction. That means the net force on this water molecule which is present at the deeper layer of the water, it is neutral. There is no net force because this water molecule is pulled by the cohesive force from all the direction. But if you look at the water molecule which are present at the surface, then there is no pull from the air region because air molecule cannot give this cohesive interaction. So there is no pulling from the air surface, but the water molecule which are present at the surface, that means the water molecule which are present at the air water interface, they will have an extra force, okay, extra cohesive force with which they will try to aggregate with one another. Getting my point? So the water molecule which are present at the surface, it is force is not neutral on this water molecule because on the surface there is air. So obviously what is going to happen, there will be an unequal forces, cohesive forces between this water molecule, as if that all of this water molecule, they are trying to aggregate with one another, they are trying to shrink in a single point. So there is an unequal tension at the air-water interface or at the surface of the water molecule, okay, because of this cohesive force, and this unequal tension which is developing at the surface, which is trying to causing aggregation of all of this water molecule to a center, or you can say that as if the water molecule is trying to shrink at a single point, this tension is known as the surface tension. So I can say here that the surface tension means it is a cohesive force, okay, cohesive force at air-water interface, at air-water interface, okay, interface. And because of this cohesive force, what is happening, as if all the water molecule, they are trying to aggregate with one another at the center, as if the water is trying to shrink at a single point. So this is the surface tension, air-water interface should be there. Now if you look at the alveolus, okay, alveolus also contain a thin layer of water inside the inner lining of the alveolus. I told you already that there is type 1 pneumocyte and type 2 pneumocyte, and type 1 pneumocyte contain the aquaporin type 5. With the help of this aquaporin, there is exchange of water in and out of this alveolus. So there is a very thin layer of water inside the inner lining of this alveolus. And just now I discussed that this water molecule, they are trying to attract with one another with the help of an cohesive force. So suppose these are the water molecule, they are trying to aggregate with one another. So now try to think that if all of these water molecule which are lining the inner surface of the alveoli, they are trying to attach with one another, they are trying to aggregate with one another. So what is going to happen? What will happen? The alveoli will get collapsed. Is it right? Yes. So all the water molecule, they are pulling with one another. So because of this, I told you that there will be development of an surface tension because inside this alveolus there is air. So there is an air-water interface, and this air-water interface will generate a tension. This tension will try to shrink this alveoli at a single point, means this tension is going to cause collapse of this alveoli, and this tension is known as the surface tension. So this blue color arrow that I have drawn here, this is nothing but surface tension. So if I ask you, surface tension is a kind of, which kind of force? It is an expansile force for the alveoli, or it's a collapsing force? It's a collapsing force because the air-water interface is causing a tension which is trying to causing shrinkage of this alveoli. So surface tension is a collapsing force. If I try to expand this alveoli, okay, so this surface tension will be helping force for expansion or opposing force for expansion. It is an opposing force for expansion. Getting my point? So if the surface tension is very high, then the alveoli is going to get collapsed. So you have to reduce the surface tension, otherwise the expansion of the alveoli will not be proper. And we all know that for reduction of the surface tension, you require a molecule which is known as the surfactant. surfactant, right? And surfactant is produced by which pneumocyte? We all know that the type 2 pneumocyte is there. Okay, so type 1 and type 2 pneumocyte, both of them are almost equal in number in lung, but this type 2 pneumocyte, they secrete surfactant into this lumen. So it is secreting the surfactant molecule. Now you look at surfactant molecule, what is the composition of the surfactant molecule, then you will understand that how this surfactant is going to reduce the surface tension of the air-water interface. So what is the composition of this surfactant? So the surfactant molecule is mainly composed of lipid, which is 90%, and protein is also there, which is around 10%. So the major component of the surfactant is lipid. If I ask you which lipid, dominantly 80 to 90% lipid is the phospholipid. And which phospholipid is the dominant one? This has been asked multiple times. The most common phospholipid which is present in surfactant is dipalmitoyl phosphatidylcholine, which is also known as DPPC. The other name of DPPC is the lecithin. So both name you have to remember. So either you remember lecithin, you remember DPPC, both of them are same, but you have to remember both of this name, dipalmitoyl phosphatidylcholine or lecithin. That is the most common or the dominant phospholipid inside the surfactant. And the second most common phospholipid is phosphatidylcholine. So dipalmitoyl lecithin or dipalmitoyl phosphatidylcholine, that is the most common lipid, and the second most common is the phosphatidylcholine. Apart from that, the protein is also there, different protein names, SPA, surfactant protein A, B, C, D, they are not very important for MCQ. Now remember, I told you that this surfactant is produced by this type 2 pneumocyte cells at the level of this alveoli. Okay, and the surfactant production begins at which age of gestation? So when the baby is inside the maternal womb, the surfactant production in the baby's lung start at 20 to 24 week of gestation, but that is the only the beginning of the production of the surfactant by type 2 pneumocyte. Those surfactant molecule are not matured, that is not fully mature surfactant molecule. So the maturation of the surfactant occurs in the fetal lung between 35 to 30 weeks of gestation. That means you can easily understand that if the baby born prematurely, particularly before 34 week of gestation, because it is maturing at 35 to 37 week. So if the baby is born before 34 week of gestation, premature born, then the lung of that baby will have deficient surfactant molecule, right? That is very important. And in that case, the baby will suffer from a disease which is known as the hyaline membrane disease. Hyaline membrane disease, which is also known as the infant respiratory distress syndrome. All of you know this thing, right? So the premature baby born means the disease is known as the hyaline membrane disease, HYALIN, or infant respiratory distress syndrome. Now this surfactant molecules also appears in the amniotic fluid between 28 to 30 week of gestation. This information is also important, and sometimes we have to assess that whether the mature surfactant is there in the lung or not. So lung has been matured or not, fetal lung has been matured or not. How that maturity is tested? The lecithin sphingomyelin ratio is measured. If that ratio is greater than 2 to 2.5, then it indicate that the fetal lung is fully mature, right? Otherwise, you have to give treatment for before the birth of the baby. Okay, so these are the composition of the surfactant. So one of the major component of the surfactant is the phospholipid. Now we all know that the phospholipid is an amphipathic lipid, right? So it will have an hydrophilic head and hydrophobic chain. Now whenever this amphipathic lipid or phospholipid is secreted at the level of this alveoli. So suppose the surfactant molecule has been secreted by the type 2 pneumocyte, and that's a mature surfactant. So it will have an hydrophilic head and hydrophobic chain. Now this hydrophilic head, it will be introduced in between this water molecule. So I told you the water molecule are there in the inner lining of this alveoli, and this water molecule is trying to causes attachment with one another. They are trying to aggregate with one another with the help of cohesive force. But whenever surfactant molecule is secreted, the head of the surfactant molecule will be introduced in between these two water molecule. So the head of the water molecule is introduced in between two water molecule. So two water molecule, they were trying to attach with one another, but now there is an hindrance in between these two water molecule. What is the hindrance? The hydrophilic head of the phospholipid molecule is introduced in between them. And whenever this hydrophilic head is introduced, you are basically breaking the continuous water layer. So this water layer was there, and water layer means this water molecule was trying to aggregate with one another. Now in between this water molecule, the hydrophilic head is introduced. So basically this phospholipid molecule is breaking the continuous water layer inside the alveoli, and whenever you break the continuous water layer inside this alveoli, this cohesive force between water molecule will be reduced, and if the cohesive force is reduced, that is going to reduce the surface tension, because I already told you that surface tension is created at the air-water interface because of the unequal cohesive interaction of water molecule. So whenever you break these cohesive forces between water molecule, you are reducing the surface tension. That's why we say that the surfactant molecule reduces the surface tension by breaking the continuous water layer inside the alveoli. Got it? So that is the mechanism of the surfactant molecule. So the major component is the phospholipid. So if you want to expand this alveoli, the surface tension is an opposing force, but who is reducing the surface tension? Surfactant. So surfactant means the alveoli will be more expansile. So what will happen to compliance? The compliance will be more. Getting my point? So surface tension is an opposing force for compliance. Surfactant molecule is increasing the compliance. Now, is the only surface tension is the opposing force? No, we have already seen that surrounding the alveoli. What is this? This is the elastic tissue. So the elastic tissue is also there, and elastic tissue also has a tendency to recoil in the inward direction, means elastic tissue will also try to cause collapse of the alveoli, that we have already seen. Means if I try to expand this alveoli, there are two major opposing force. One is the surface tension and second one is the elastic tissue. Now with this concept, we are going to understand that if this elastic tissue is destroyed or if the surface tension is more, then what will happen to the compliance? Means we are going to understand that what will happen to the compliance in pathological scenario. So compliance is stretchability or expansibility. So the opposing force, I am writing like this, that the opposing forces, opposing forces during the expansion of the alveoli, number one is the surface tension, right? And number two is the elastic tissue surrounding the alveoli. Now between these two, surface tension is responsible for 2/3 of the opposing forces and elastic tissue is responsible for the 1/3 of the opposing forces. Now tell me, if these opposing forces are more, what will happen to compliance? Compliance will be low. And if the opposing forces is lesser or decreases, then what will happen to the compliance? Compliance will be higher. So whenever I am writing high compliance means you have to reduce the surface tension and you have to reduce the elastic tissue. So number one, surface tension will be reduced if the surfactant is more. So more the amount of surfactant, increased amount of surfactant means there will be more compliance, right? High compliance. And second thing is that if the elastic tissue is destroyed, destruction of the elastic tissue is typically seen in case of emphysema and in case of chronic asthma and in case of old age lungs. Getting my point? So emphysema, some of the alveoli they expanded more and more, and the expansion is so severe that some of the alveoli get ruptured. So whenever there is rupture of some of the alveoli, then the elastic tissue which is surrounding that alveoli is also get ruptured, and elastic tissue rupture means the elastic tissue is destroyed. Destruction of the elastic tissue means the structure will be easily expansive and easily stretchable. What will happen to compliance? Compliance will be high. So this is a very, very important concept that you have to remember, that more the surfactant, more will be the compliance, and compliance is more when elastic tissue is destroyed. The typical example is emphysema. Although chronic asthma will also have a similar condition, but not like that much of the emphysema. So emphysema and old age lung will also have the similar picture. So in all of these three conditions, the compliance will be very high. Now whenever I am using the word emphysema, be a little careful. Emphysema means not all the COPD patient will have high compliance. So use the term COPD. Okay, COPD patient, under the COPD patient, the chronic bronchitis is also there. But please remember that bronchitis patient, okay, bronchitis patient will have normal compliance because bronchitis is dominantly affecting the airways region, not that of the alveolar region. But emphysema is typically destroying the alveolar region and parenchymal region. So that's why whenever I say COPD, all COPD will not have the high compliance, but emphysema definitely will have high compliance, and chronic asthma will also have a higher compliance, and same for the old age lung, but not for bronchitis. The bronchitis means normal compliance. Now whenever I will say that low compliance, okay, low compliance, so what you are thinking of? You are thinking that if the surface tension is very high, so the surface tension high means there is deficiency of surfactant molecule. And what disease we have just discussed? We have just discussed that if the baby is born prematurely, then he will suffer from a disease which is known as the hyaline membrane disease, which is also known as the infant respiratory distress syndrome. So the infant respiratory distress syndrome will have low compliance, and because of the low compliance, the lung will not be able to expand properly, and the infant will suffer from respiratory distress. Got it? Okay, so this is deficiency of surfactant. And second thing is that elastic tissue, if this elastic tissue become more harder, so whenever the elastic tissue is replaced by fibrous tissue, that means fibrosis of the lung is a typical example of low compliance lung, because the elastic tissue is replaced by harder structure, that is the fibrous tissue. Not only fibrosis of the lung, so fibrosis of the lung plus all of the restrictive disease of the lung, will have, okay, low compliance. So any kind of restrictive disease, it may be pulmonary restriction, like for example fibrosis of the lung, or it may be extrapulmonary restriction. Suppose the person is suffering from kyphoscoliosis. In that cases also the person will have low compliance, because the expansion of the lung will not be proper. So please remember that low compliance means fibrosis of the lung and deficiency of surfactant, typically is the infant respiratory distress syndrome. And high compliance means surfactant is very high, and emphysema is the typical example that you have to remember. So this is the concept which is very important for your MCQ. It has been asked multiple times. Okay, so now the concept of compliance surfactant is also done. Now we are going to discuss compliance curve, how the compliance is plotted in a curve. Okay, so to plot the compliance, try to imagine, so suppose you have an alveoli which is completely collapsed, right? So this is the completely collapsed alveoli. Okay, so this is the completely collapsed alveoli. So when the alveoli is completely collapsed, okay, so we all know that the smaller size bronchioles will be collapsed also, and alveoli will contain a little bit of air which is around 500 ml, which is known as the minimal volume. Now if you want to expand this structure more and more, so what you have to do, you have to give some positive pressure through this smaller size bronchioles. Okay, so you are injecting pressure and you are trying to measure how much will be the volume change in this alveoli. That is your compliance. So the compliance curve is calculated or plotted in this way, that you have a collapsed lung. So experimentally you have a collapsed lungs. Okay, and in this collapsed lung you are injecting some pressure, and with that injection of pressure you are calculating how much volume change is happening inside this lung, right? So initially when the alveoli are fully collapsed, the bronchioles are fully collapsed. In this condition, if you inject pressure, this pressure is not going to inflate the alveoli properly, because in this condition the surface tension is very huge. Okay, so when the alveoli are fully collapsed, okay, surface tension is very high. So I am writing here, in this condition the surface tension is very high, very high. So if the surface tension is high, if you inject pressure, little pressure, do you think the expansion is going to happen? Answer is no. So initially, if I plot this curve, that pressure change and volume change I am plotting, initially if I inject huge amount of pressure, then also the volume change is not going to happen significantly. So look at this curve. So this blue color curve indicate that although I am injecting, although I am giving huge amount of pressure, but the volume change is not happening properly, flat kind of curve. But whenever you reach up to a critical pressure, some of the bronchioles will open up. And after opening up of this collapsed bronchiole, then if you inject a little amount of pressure also, there will be huge amount of expansion of this alveoli. Getting my point? So after the initial phase, when the surface tension was very, very high, after that, when some of the bronchioles open up, even if you inject a little amount of pressure, the volume change will be very, 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 very high. Means exponential increase in volume change is going to happen like this. Okay, and then you will reach up to a plateau phase where the expansion has been done completely and no further expansion is possible. So again there will be a plateau phase. So this kind of typical curve is seen during the inflation of the lung from the complete collapse stage. So complete collapsed lungs was there. Now you are trying to inflate. Inflation means you are constantly measuring the change of volume and change of pressure. So this is an inflation curve. Inflation curve of compliance, right? Now during inflation, surface tension was the opposing force, and what about the elastic tissue? Elastic tissue was also the opposing force. Okay, so now you have expanded this lung up to this point. Now after expansion, if you release this lung, the lung is going to get collapsed. Now whenever the lung is getting collapsed, what will happen to this opposing force? They will still opposing the expansion or they will enhance the recoiling. Okay, getting my point? So after expansion, if you just release these two opposing force, surface tension and elastic recoiling, they will still oppose this recoiling or they will enhance this recoiling. Obviously, they are going to enhance, because whenever you are trying to expand this alveoli, the surface tension, the elastic tissue, both of them are acting in the opposite direction. But when you are deflating the lung, both of these force, the surface tension and the elastic tissue, both of them will causes enhance deflation. So the typical deflation curve of the lung is not going to follow the same pattern. The deflation will be faster than that of the inflation. So this arrow indicate this is the deflation curve of lung, deflation curve or compliance during deflation of the lung. So I am finding out that there is a gap between inflation and the deflation curve, because during inflation, surface tension was the opposing force and that was the dominant opposing force. Along with that, elastic recoiling force was also the opposing force. So the inflation was very, very difficult. Okay, but after full inflation, whenever I am releasing this lung, it is deflating and the deflation is happening with huge amount of force or rapidly. So there is a typical gap between two curve, inflation and deflation curve. There is a gap, and this gap is known as the hysteresis property of the lung. Hysteresis property of the lung. So this inflation and deflation curve, the gap between these two curves is known as the hysteresis property of the lung. Means inflation and deflation is not following the same pathway. Got it? Okay. So this is the typical compliance curve. So there are two compliance curve. One curve is plotted during inflation, so inspiratory compliance curve, and one curve is plotted during deflation, that is the expiratory compliance curve. Okay. So the hysteresis property is present only because of the surface tension and elastic tissue. These two forces are basically causing this hysteresis curve. Otherwise, they will follow the same path. So how to prove that? Proof can be done whenever you fill this alveoli with water, saline filled lung. Okay, so what I'm saying, look at this curve. I told you the concept of surfactant. So now suppose I am filling this alveoli, okay, filling this alveoli with saline water. So whenever you fill the alveoli with saline water, okay, so saline water is filling the alveoli, right? Okay, look at. So whenever the alveoli is filled with saline water, do you think the surface tension will be there? So this is my saline water. Saline water. Okay. Do you think the surface tension will be there? Answer is no. Why? Because surface tension originate when there is an air-water interface. Whenever you are filling the lung or alveoli with water, saline water, inside the alveoli saline water is there. Not like that of the pulmonary edema. That's a different concept. Pulmonary edema water will be there in the interstitial tissue, not inside the alveoli. So inside the alveoli, whenever filling the saline water, air-water interface will vanish. And whenever there is no air-water interface, what will happen to the surface tension? Surface tension will be near equal to 0. So now you apply this concept in the curve. So if I give you an alveoli, okay, or alveolus or whatever, and that alveolus is filled with saline water. So what will happen to the compliance of that saline filled alveolus? It will be lesser than this normal curve or more than that of the normal curve. Because you are vanishing the surface tension, the compliance of that curve will be very, very high. So the inflation curve will be higher position than that of the normal inflation curve, and the deflation curve will also follow almost the same pathway. The deflation curve will also follow almost the same pathway because this is recorded with saline filled lung. Saline filled lungs. Getting my point? So whenever you fill the lung with saline, then this hysteresis property is not going to be present because the difference between two curves is mainly due to opposing force surface tension. Whenever you fill the lung with saline water, the surface tension is gone and these two curves will follow the almost the same pathway, although there is a little bit gap still present, and this gap is due to the opposing force, that is the elastic recurring force, but the surface tension is not there. So that's why whenever you fill the lung with saline water, the compliance increases and the hysteresis is not there. The inflation and deflation curve will follow almost the same pattern, right? So this is given in Genong also. If you look at Genong, so this is the curve which is given in Genong. So this is inflation curve and this is deflation curve when the lung is filled with air. But the inflation curve and deflation curve will follow the same pathway, almost the same pathway when you fill the lung with saline water. Saline filled lung means the surface tension will not be there. The surface tension is not there, and because the surface tension is not there, the hysteresis property is also not there. Got it? So this is typical the compliance curve which is given in Genong. So I repeatedly told you that compliance can be calculated during inflation also, the compliance can be calculated during deflation also. Generally the deflation compliance curve has a higher compliance than that of the inflatory compliance curve, right? So in your books or in your MCQ, you will sometimes get this kind of compliance curve. So here only the expiratory portion of the compliance curve has been given. So you have to imagine that if you look at this normal curve, so this is inflation and deflation curve, but both of this inflation and deflation has not been given. Here only the deflation part or the expiratory compliance curve has been given. So first you look at this normal curve. Okay, suppose I have given this diagram as an image based question and I ask you calculate the compliance of this person, only the normal curve is given. So how you are going to calculate the compliance? So you have to drop one imaginary line on this compliance curve. Okay, so look at what I am doing, then you will understand. So I am dropping one perpendicular on this compliance curve. Okay, so from 5 liter and from 3 liter I am dropping another perpendicular on this curve, and then look at this. Okay, so what I have done here, I have dropped one perpendicular on this curve and another perpendicular from this point. So this is the normal curve. Onto this surface of this normal curve I have dropped two perpendicular. Okay, now this perpendicular is cutting this curve at a particular point. Okay, from there you have to drop another perpendicular onto the x-axis. Okay, so another perpendicular I am dropping onto this x-axis. Okay, so from this point and from this point, x-axis. Now it is done. So now I am looking at that at the level of y-axis, 5 liter and 3 liter. From this 2 point I have made two perpendicular. I have made two perpendicular from this 5 liter and 3 liter. So the difference between this 5 liter and 3 liter, this is nothing but my delta V volume change, and this volume change has happened because of pressure change. And how much pressure change? So I have already dropped two perpendicular on this x-axis also. So the difference of pressure between these 2 points, this is nothing but my delta P. So this is nothing but my delta P, right? So from here, delta P is approximately 10 and 20, the difference between these two. So basically 10 and 20 difference means 10 centimeter of water approximately, okay? And delta V here is equal to difference between 3 and 5 liter, that is 2 liter, right? So easily I can calculate that delta V upon delta P, right? So delta V is 2000 ml, right? 2 liter, and this is 10 centimeter of water. So how much is the compliance of this person? 200 ml per centimeter of water. Means if you change 1 centimeter of pressure inside this lung of this person, then 200 ml volume expansion is going to happen in the lung. So this is the meaning of the compliance from this normal person. Now if you look at one curve which is situated above this curve, so the one curve which is situated above this normal compliance curve, so I can easily understand that this person will have a high compliance, and we have already understood that emphysema patient will have high compliance because of the loss of the elastic tissue, and one compliance curve is located below the normal compliance curve, so obviously this will have low compliance. So we have already seen that fibrosis of the lung will have low compliance. Not only that, all the restrictive disease of the lung will also have the low compliance. So this kind of compliance curve is also given in exam, right? So please understand the compliance curve. This is very important topic. Now in the previous session, that is the mechanics of the respiration, we have also seen the compliance of lung and respiratory system, compliance of the chest wall, and compliance of only lungs. Okay, so could you recall this curve? We have already understood that this is the compliance curve of the lung. Why we are saying this is compliance curve? Because in x-axis we are plotting the pressure change. Here the transmural pressure is calculated, and in y-axis we are calculating the volume change. So I told you at the beginning of this session that compliance means in x-axis you are plotting the pressure. This pressure may be intrapleural pressure, it may be the transmural pressure, and in y-axis you are plotting the volume. So if I given only the chest wall, then this is the compliance curve of the chest wall only. If I give you lung and chest wall combined, that is the compliance of the respiratory system, this is the middle curve. And if I give only the lung, this is the compliance curve of only lung. So from this three curve, if I ask you the compliance of which structure is maximum, you will easily understand that the compliance of the chest wall is maximum among all of these three. So compliance of chest wall alone is maximum, that is 200 ml per centimeter of water. If you calculate the compliance of lungs only, this is near equal to chest wall but a little lesser than that of the chest wall. You can easily find out that this brown color curve is the only lung compliance, so that is 150 to 200 ml per centimeter of water. And if you calculate the compliance of the whole respiratory system, lung and chest wall both are there, okay, then that is very lesser, that is only 85 ml per centimeter of water. Okay. Now apart from that, you have to remember another 3 points about compliance. Compliance of adult lung is more than that of the children's lung. More the volume of the lung, more the size of the lung, the compliance will be more. So adult means larger size lung and children means smaller size lung. So obviously compliance of the adult lung is more than that of the children lung. Then compliance of the base is more than that of the compliance of the apex of the lung. We have already understood this concept on the ventilation perfusion chapter, that expansion of the base is more than apex, so compliance is more at the base. Okay, and then compliance is maximum at FRC. If you look at the compliance curve of this lung and chest wall respiratory system, then you are finding out that there is a flat portion when the lung and chest wall is completely expanded, and there is a flat portion when the lung and chest wall both are compressed to a very little volume. That means whenever the lung and chest wall is reaching at the residual volume or lung and chest wall is reaching at the TLC, at both of these conditions the compliance is lesser. So compliance is maximum at which point? At the center part, and that is nothing but the FRC. So compliance is lesser at extremes of volume. Extremes of volume means if maximum inspiration, that is TLC, and at the end of maximum expiration, that is residual volume. At both of these conditions, the compliance is lower. But when the lung is in resting condition, that is at FRC, at that point, if you calculate the compliance, that will be maximum. So these are the points that you have to remember along with compliance curve. Now at the end, we are going to discuss that so far we have discussed compliance, and which compliance we have discussed? So far we have discussed the static compliance. So whenever we are discussing compliance, we told you that compliance will be more if the opposing force is less. And where from these opposing forces are coming? The opposing forces are coming from the elastic tissue which are present surrounding the alveoli, the elastic tissue which are present in the parenchyma, and the elastic tissue which are present in the chest wall, as well as the surface tension. So basically, the compliance that we have discussed, that is known as the static compliance, and it gives you the status of your lung alveoli, the status of your lung parenchyma, and the status of your chest wall. If any of this structure is stiffer or harder, then what will happen to the static compliance? Low. Like for example, we have discussed the fibrosis. Of the lung. Okay, so fibrosis of the lung means this parenchyma is getting fibrosed, or the alveolar wall is getting fibrosed. So what will happen to the compliance? Compliance will be lower. And we have also discussed that if this elastic tissue of the lung and lung parenchyma are destroyed, then compliance will be more. Okay. But whenever you measure the compliance taking into consideration the resistance of the airway. So imagine one situation that you are measuring the compliance, you are measuring that how much volume change you are going to do if you give one equal amount of pressure. So you are giving delta P and you are measuring the volume change, but you are also considering that the airway resistance. So if the airway resistance is high, then if you give huge amount of pressure also, volume change is not going to happen significantly. Means if the airway resistance is high, then it is decreasing your expansion of the lung, and whenever you are considering airway resistance along with the static compliance component, then that compliance is known as the dynamic compliance. So dynamic compliance means when breathe in and breathe out it consider, that means airway resistance is also coming into play. That's why we have written here that dynamic compliance means airway resistance you have to consider plus the component of the static compliance. The component of the static compliance we have already discussed. So if there is problem in any of this component, either the airway resistance is high or component of the static compliance is harder, then your dynamic compliance is going to be reduced. So suppose I am saying one condition where only airway resistance is high. Okay, so suppose I am giving one condition where only airway resistance is high. Airway resistance is very high. So what will happen to the dynamic compliance in this condition? The dynamic compliance will be lower, obviously. And what will happen to the static compliance in this condition? It is also going to be lower. Although there is no problem of the static compliance, only the airway resistance is high, because I told you that dynamic compliance means, okay, so dynamic compliance means it is considering the airway resistance. Okay, so dynamic compliance will be low, but I'm sorry here, the static compliance will remain normal because the component of the static compliance is normal here. So when only airway resistance is high, in that cases the dynamic compliance will be definitely low, but the static compliance will remain normal because the component of the static compliance is intact here. But suppose one condition where you are saying the fibrosis of the lung, in these cases what will happen to the dynamic compliance? Dynamic compliance will also be lower, as well as your static compliance will also be lower. Why static compliance is low? Because already you have discussed fibrosis means static compliance has to be low. But look at why dynamic compliance is also lower in this condition. Because dynamic compliance includes airway resistance plus the component of the static compliance. So whenever static compliance is low, dynamic compliance is also going to be lower. But when only airway resistance is high, in that cases dynamic compliance will be lower, but static compliance is not lower, right? Getting my point? So this concept you have to remember, the difference between dynamic and static compliance. And the last one is specific compliance. Specific compliance means any compliance you measure. Suppose you have measured the static compliance. So the static compliance upon the FRC of the lung, functional residual capacity. If you divide this, then it will give you the measure of the specific compliance. So specific compliance is basically the compliance value which we use to compare the compliance between person to person. Suppose one person has a larger lung and one person has a shorter lung. Obviously the shorter lung will have low compliance, but if you want to compare the compliance of unit volume of lung, then you have to use the specific compliance, that compliance upon the FRC. So the higher lung will have higher FRC also, so the compliance upon FRC, okay, that's a standard. Okay, and the lower lung will have lower FRC, so compliance upon FRC, low FRC. Then you compare these two value, you will get the exact comparison of compliance, not the absolute compliance value. Okay, so that's why specific compliance is generally used for comparison of compliance between person to person, different size lung. Okay, so this is all about different types of compliance. Now we are going to look at certain MCQs from this chapter. In case of infant respiratory distress syndrome, there is deficiency of which of the following lipids? So infant respiratory distress syndrome, I told you, this is also known as the hyaline membrane disease or infant respiratory distress syndrome. So surfactant is deficient. The major component of surfactant is lecithin, right, or DPPC or DPPC. See, this question has been asked twice. Okay, so this is very, very important and very easy. Which of the following cells are deficient in premature infant with IRDS? So again, this question on hyaline membrane disease. Okay, so we have already discussed that the type 2 pneumocyte is going to secrete the surfactant. So surfactant is deficient. Okay, so infant respiratory distress syndrome, type 2 pneumocyte. A baby was born on 28 weeks of gestation. What is true about this newborn? Okay, in this newborn. Okay, so this newborn is 28 weeks of gestation, so obviously premature, so the person is going to suffer, the baby is going to suffer from hyaline membrane disease. So hyaline membrane disease means surfactant is deficient. So what will happen to the surface tension? Surface tension will be very, 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 very huge. What will happen to the compliance? Compliance will be very, very low. So surface tension decreases, no, this is a false statement. Surface tension increases, true. Compliance decreases, true. So this is a true statement. Child lung has more compliance and less surfactant. This is a false statement. I told you the child lungs is less compliance than adult lung. Child lung has more surfactant and less compliance. This is also false. Okay, more surfactant is not there, less surfactant is there. Lesser volume lung means lesser surfactant will be there. So only true statement here is the B. That is going to be my answer. Okay, compliance curve of the lung is given. A curve signifies. So 3 curve has been given. One of them a Longman curve. So x-axis is the transpulmonary pressure and y-axis is the volume. So these are all the compliance curve. These are all the compliance curve, right? So compliance curve, here the curve A means this is the high compliance curve, high compliance curve, right? So this question has been given that what is A? So A means high compliance. Among all of this example, emphysema has the higher compliance, so A, C is going to be my answer. And curve B, that is a low compliance, so this is typically of the fibrosis of the lung. This is typically of the fibrosis of the lung or lung atelectasis can be from this given option. So this is all about your compliance. Thank you so much.